Hi from healthvideos.a2z.com in Bali and Singapore. A family doctor for 46 years, I then had my own addiction clinic for 5 years, where my team and I treated over 5,000 alcoholics and addicts in over 40,000 consultations. Many had been severely traumatized by sex addicts. Most addictions are caused by several things that together cause serious suffering, which a chemical or behavioral addiction relieves. To properly fix addictions, we need to find and fix all the things that cause them, but ordinary consultations are too time-consuming and often miss things. I found what worked best was asking people what they wanted, needed to get rid of to make their lives better, and asking those questions in a systematic online checklist. Online videos were then the best way to give people an understanding of the problems found through the checklist and the solutions to those problems. I started working 3 half-days a week in an erectile dysfunction ED clinic in 1991, then attended 2 world and 2 regional ED conferences and presented at one, wrote and sold 6,000 copies of booklet on ED, and developed an ED website that this video supersedes. I treated over 1,000 men for every type of sexual problem and the associated physical, mental, and social problems. Sex addiction may develop when a man's life is empty, dark, and unsatisfying, and porn often makes it worse. Sexual stimulation increases brain and gland production of feel-good endorphin chemistry, which is over 20 chemicals that cut many kinds of suffering and give good feelings. But as with all types of addiction, sex addiction soon starts to lose its effect, which is called tolerance. And to get the stronger effect again, sex addicts, like other addicts, crave more frequent and stronger doses of what they're addicted to, so their sexual activity may become extreme. To prevent sex addiction disaster, boost your feel-good endorphin chemistry and quality of life in other ways. To quickly find what videos, medicines, and counseling therapy will help you most, do the What I Want Need checklist at healthvideos.a2z.com, and its instant report will advise you based on the wants, needs you chose high scores for. A better life with less frequent sex will then reduce your tolerance. Sex will be more satisfying and your whole life will get better and safer. If you don't have a partner, go to as many places as possible where you're likely to find your kind of people. Try to find someone with feelings, wants, needs, interests, and lifestyle preferences like yours. Visual attractiveness and strong chemistry can feel great, but can occur even when there is serious incompatibility that soon leads to conflict and suffering. There's nothing better than real compatibility of feelings, wants, needs, interests, and lifestyle preferences. Erections arise when sexual stimulation causes the arteries in your penis to open wide, so every time your heart contracts, more blood is pumped into your penis and blows it up like a balloon. If your erections weaken, which is called erectile dysfunction or ED, it's safest to assume that your arteries are becoming hardened and narrowed, and to get your doctor to check your blood pressure, cholesterol, fats, and sugar. Go on a high fresh vegetables, fruit, berries, nuts and seeds diet, and cut sugary, fatty, and high cholesterol foods, such as sweet things, dairy foods, eggs, and fatty meat. Also read Dr. Greger's book, How Not to Diet, which is even better than his previous book, How Not to Die. Many of my ED patients had previously had heart attacks, coronary artery bypass surgery, stents or strokes, and one had a heart transplant. What causes the narrowed arteries that causes all those problems also causes the narrowed arteries that weaken erections. So fix everything at once. The two best ED treatments have been tadalafil Cialis tablets and PGE1 prostaglandin penis injections, but both are costly, the injections are inconvenient, and the tablets are slow. Cialis powder on and absorbed through your tongue from a pocket powder medicine dispenser anytime, anywhere in seconds works faster than swallowed tablets that have to pass down the long gut and through the liver to start working. And powder in pocket dispensers give flexible dose sizes so you can easily find your personal best dose, which varies widely in different men. And dispensers are often more convenient and lower cost than tablets. Get a pocket powder medicine dispenser and use it like this. Three weeks after prostate or other surgery, if your erections are weak, start tadalafil powder on alternate days, and if it's not working in 3 weeks, add penis prostaglandin E1 injections that always work. The powder then usually starts working and is more convenient. I treated men up to the age of 86. Avoid the vicious cycles some men get with ADD that make everything worse, such as more alcohol, smoking and drug use, eating unhealthy artery-blocking comfort junk foods, and workaholism. If you have premature ejaculations which weaken your erections, tadalafil powder may fix both of those problems. For premature ejaculation without erectile dysfunction, sertraline 50 to 150 milligrams daily is usually best. It's an antidepressant with a side effect of slowing ejaculations. Prozac, or fluoxetine, antidepressant, slows premature ejaculations and also reduces sex drive, which is helpful in some cases and not desirable in other cases. Never take artificial testosterone for ED, as only 5% of ED is caused by testosterone deficiency. Testosterone increases sex drive but rarely helps erections, so it increases sexual frustration. ED cuts sexual activity, which reduces natural testosterone production, but that is restored by fixing ED. Artificial testosterone shrinks testicles and cuts natural testosterone production, which can cause need for permanent, costly artificial testosterone. I remember a 26-year-old gym worker and a 33-year-old weightlifter with ED, very low testosterone and small, soft testicles. They'd taken bodybuilding steroids and their testicles never recovered. If artificial testosterone or bodybuilding steroids have started to cut your testosterone and sex drive, that can sometimes be slowly reversed. Take tadalafil second daily, have lots of affectionate intimacy, regular exercise, and a good diet high in fruit, vegetables, berries, nuts, and seeds. Once a week, take artificial testosterone and tadalafil, then a few hours later have a prostaglandin injection and intercourse. All that boosts your mental, social, hormonal, and circulation factors with minimal technical suppression and may gradually restore functioning if your feel-good endorphin chemicals are low and you're miserable. Poor or sex addiction may boost your endorphins and mood, but you soon develop a tolerance to them and they may then cause many other problems. For far better ways to boost your low endorphins, see the videos on Bacnol and low-dose naltrexone LDN at healthvideos.com. Sex addiction tragically and needlessly wrecks many victims and predators' lives and families and kills some. Over a lifetime, most pedophiles traumatize around 200 victims, leaving a terrible trail of pain, damage, and death. Endorphin-boosting Bacnol or LDN plus Prozac or cyproterone cut dangerous sex drives. I remember a paedophile butcher who killed himself with an abattoir gun when the police came after him. What a disaster for his 3 daughters, ex-wife, and that man. Many years later, a university student kept poor by visiting prostitutes was very grateful when I prescribed cyproterone and the addiction was broken in 2 days. Today, I'd also boost his endorphins with Bacnol. Having to get up to the toilet 2 to 4 times per night ruins some older couples' rest and sex life. See the bladder, sleep disturbance, and Bacnol and LDN videos at healthvideos.com. Please watch this video several times and go to its text at healthvideos.com and click on links of interest. If possible, spend 10 minutes now at healthvideos.com doing the What I Want Need checklist. The checklist instant report explains which videos, medicines, and counseling therapy most help the particular wants and needs for which you chose the highest scores. healthvideos@gmail.com have contact details for suppliers of low-priced pocket powder medicine dispensers worldwide. From international Bali and Singapore, I'm keen to pass on helpful information to distressed people and their carers anywhere in the world. Please leave comments and questions below. Best wishes and good luck from healthvideos.com and the Fix Suffering Early, Simply and Safely system.